So silver tsunami refers to rapidly aging population across the globe. If you look at US, we're going to have more than 65 million Americans who are going to be above the age of 65 by, I think, 2050. And then whether it's a facility or it's an employer or it's a person providing caregiver, we want to be that platform to enable safety for the patients and also at the same time target the burnout for the care providers, because care providers want to provide the care, but they are not able to because we are in 2025 and we are using technology from 1980s. So we need to change.
Did you know that in 2020, there were 53 million caregivers in the United States? And by 2025, this number is expected to grow to 62.5 million. 73% of these caregivers also have a job. They are called working caregivers, and they are invisible because they don't talk about their caregiving challenges. Working Caregivers, the Invisible Employees, is a podcast that will show you how to support working caregivers. Join Selma Archer and Zack on the Working Caregivers, the Invisible Employees podcast as they show you how to support working caregivers.
Good morning, good afternoon, good evening from wherever you are and whenever you are. We want to welcome you to our podcast. This is the Working Caregivers, the Invisible Employee podcast. My name is Zack.
And I'm Selma Archer.
Selma Archer, my partner. How are you doing?
I'm great. How are you doing, Zack?
I'm doing good. It's middle of summer and we are, enjoying it with the grandkids and all that other good stuff.
Nice.
How about you?
I think that I just went to bed on Friday and then I woke up and it was Monday. That's how fast time is going for me.
Wow. You might need some technology to help you slow down.
Yeah, we have a guest maybe can help me with that, right?
Absolutely. We are so thrilled to have Breana Patel.
Hi, how are you? Thank you so much for having me.
Thank you for being here. We discovered Breana through a recent guest, Susie Singer-Carter. So shout out to Susie. And we also listened to your podcast, your interview with her, and it was so fascinating. We thought that this is really important for working caregivers to kind of learn a little bit more how AI or technology can make our lives easier. And that's what it's all about. So thank you for being here.
No, it's an honor to be here.
Well, you're doing some great work, and we want to spread the word. So before we do that, though, we always like to ask our guests a little bit about where you live, maybe something kind of fun or trivial.
Well, I split my time between New York and New Hampshire, and I feel those are the exact opposites. One is really busy, and the other is really peaceful and quiet. So I enjoy the contradictions of the two places.
Yeah.
I've driven through New York to New Hampshire, and you're 100% correct. Those are two different states. Well, lower New York is definitely different from New Hampshire, but I don't know how you live two lives. Maybe you use technology to help you with that too. So, but let's get started because I got to tell you something. Selma and I are not no spring chickens. Oh, she's going to get mad at me for saying that.
Hey, speak for yourself.
We are baby boomers, Selma. We're baby boomers, and we're either afraid of AI, we're just trying to figure it out, or we're embracing it. So we got to learn more about it, and that's why we're really, really happy that you're here. So before we get into all the technology stuff, let's talk about caregiving stuff. I understand that you do have a caregiving story. Perhaps you could share that with us.
Yeah, absolutely. So my grandmother had a stroke, so her left side of the body was paralyzed, and as a result, her movement and mobility was significantly impacted by this. And there was one time when she was hospitalized and she experienced an adverse event. And that adverse event, a hospital fall, led to like a secondary complication, which really impacted her quality of life in the last years. So that was devastating. And I was like, how come in this day and age, there's no way for us to be able to provide the quality of care that a patient would deserve? Because she laid in that fallen position for hours. And when you lay in that position, it can lead to a lot of issues like internal bleeding, and also impacts the dignity of the patient itself, because then they kind of feel a embarrassment and don't want to get up again and do things, and that deconditions their health. So those were the first hand experiences that I experienced with my grandparent.
I just wondered how those experiences impact what you do now.
Yeah, it impacts in a huge way. So I started my career in finance and banking, and then my last company that I sold served banks as well as public sector agencies like Department for the Health. And when I sold my business, I wanted to launch another one that would not just be profitable, but also have an impact in the world. And this problem always stayed in the back of my mind, that there must be a lot of elderly patients like my grandmother who might be going through similar experiences. And so I started talking to a lot of patients, providers, and all the stakeholders across healthcare industry. And over the course of like a couple of months, ended up speaking with more than 500 people one-on-one, going to hospital lobbies and stopping people and asking about their experiences. And then really identified that there's a common theme across the board. It's not just one isolated in this incident, but this happens across the industry, causing like more than $50 billion also in annual cost burden to the healthcare facilities, along with patient suffering. That was like the starting point. And I always want to make an impact so that no one else's family has to go through the same trauma that we've been through.
Wow. Well, we thank you in advance for all the work you're doing, because I totally can relate. My mother is in a nursing home. My father had a stroke, and he fell, broke his back, and they had to do surgery. End up getting an infection in the wound, which how can that happen?
Yeah.
But there were a lot of reasons why that could happen, but having to rotate them and do things like that, they just weren't on top of it. I hate to say that, but that I think you mentioned, Breana, that there are so many patients, there's so many healthcare providers, right? I mean,
Yeah.
the numbers changing. It's
Yeah, absolutely. The numbers are absolutely changing because the aging population is increasing. And the number of the caregivers, there's a record shortage of caregivers and care providers. In fact, somewhere earlier this year, there was a research published that there were 229,000 nurses that dropped off from the workforce of providing care to the patients. So we are at that intersection where, the nurse to patient ratio has gone up really high. In a hospital setting, in like a step down unit, it's gone up to like one nurse to four patients.
oh my
And when
goodness.
patients have multiple chronic conditions and they are in post acute care, there's a lot of heavy lifting. So absolutely, it has been like one to many patient ratio, nurse to patient ratio.
Brian, as I mentioned, my mother's in a nursing facility, and I try to go down there. I'm a long distance caregiver, and I try to go down there every other month.
Yeah,
And when I'm down there, I see things, that I try to, give them feedback on and help. But the classic, I ring my bell and nobody comes. And so that's really frustrating, not just for my mother, but for me. And it's hard for me to focus on my work when she calls and she's telling me no one's coming and I've got to contact the front desk and do all these things. And I know that it's not just my mother's nursing home, that this is a national issue. How can, in your opinion, or if you're working on things, how can AI not just help the patient or the resident for better patient outcomes, but the family caregiver as well, like me, so that I
yeah.
can't, so I can stress less, and worry less.
Yeah, absolutely. And that is a very common use case that I've also seen while going to our potential customer sites and doing the research, that, nurses are not able to meet the calls that are being made with those bells. And because the care staff is also desensitized to a lot of alarms and alerts going on constantly. So they really don't know when it is actually for real. So these are the kinds of the situations and times when AI or technology can help to identify and prioritize alerts that, maybe this is like a very high risk and patient is really in a critical state and you need to attend to this patient right away. Or times when, you can have also some type of voice AI where you're just, calling for help as a family of someone who's in the nursing home and you want to make an appointment. The voice AI can do that for you. They can actually call interfacilities and make appointments for you. So this way they are freeing up the care staff to focus on actual work, which is providing care versus doing other types of activities. And that can help in increased productivity and addressing the burnout, as well as help in elevating the quality of care for the patients as well. And at the same time, provide transparency to the family, like providing time to time updates on, what has been the activity level. For example, if your mother today in the nursing home, she's been active, she went out of the room, or she was reading, watching TV, or her mood you can even look at the mood levels of the person throughout the day, if there has been some kind of agitation or confusion. And I guess having access to that information itself on regular basis, that helps to also combat with your anxiety as a care provider to your family, because you're constantly worried. This is someone you love and who is your family, and you want to know what's going on with them.
That's fascinating, because I'll tell you, and I certainly could use something like that, because, I'll give you an example that's common. And I imagine some of our listeners are probably nodding their heads as they're listening to this, but I'll get a phone call in the morning from mom. And she's really good, actually. But when she calls, it means there's an issue. And she will tell me that there's an issue, whether it's medication or a nurse or a caregiver didn't treat her so well, or she still hasn't had a shower. And she'll tell me that. And then I've got like 2 or 3 calls, conference calls and Zoom calls. And I'm worrying about that. But how cool that would be to be able to pull that up. And I could be looking at that to see how is her frustration. Has she calmed down? Did they ever get to her? That would be amazing to have that. It would help me significantly.
Yeah, absolutely. And LLMs, the large language models, have the great abilities to summarize a lot of things. So all the activities can be summarized and bucketed and be provided in a type of a content that is easily consumable by the family and readable and understandable in plain English. Because a lot of times there's also medical jargon that a family care provider may not understand. So these are the kinds of, the potentials of technology that could be implemented to provide, peace of mind to everyone who's involved. I mean, even the care providers like nurses, they want to deliver care and they don't feel satisfied because they were not able to spend time with the patient enough. So I guess this is like a 3-folded benefit for patient, provider, as well as the family.
What'd you call that? LAM?
LLM, large language model.
Large language model. LLM. Wow. That just so one more thing, because I heard you say that it can make phone calls for you, and I'm probably half joking here, but if they could call Medicare and they could call my insurance companies for me, and help, because you're on waiting. You're waiting, which is another administrative issue that we deal with as working caregivers. We're trying to focus on our job, yet we've got to make that phone call that we know they're going to put us on hold for a half hour. If it could do things like that for us, I'm in. I'm 100% in.
Absolutely. It's actually not too difficult if you feed the information, obviously with guardrails on what not to say and what to say, and train the model. Then the voice AI can actually make the calls on behalf of you to wherever you want to. It could be personalized to you. Yes.
That's amazing.
Yes, it is. I was wondering about, you mentioned on your podcast the term silver tsunami. And I've run across that term in a lot of the research that Zack and I have been doing, either gray tsunami or silver tsunami. I wonder if you could talk a little bit about that and maybe terms of what society can do to address it, as well as what employers might be able to do.
So silver tsunami refers to rapidly aging population across the globe. If you look at US, we're going to have more than 65 million Americans who are going to be above the age of 65 by, I think, 2050. And then we look at Japan, that has a growing aging population. Italy. There are so many countries across the world that have extensive increased aging population, and that's what silver tsunami refers to as a term. The second question to address is, what can society and employers do to address the silver tsunami? Is absolutely to acknowledge that this shift is happening, and then invest to support an infrastructure for having the technology, the framework, develop businesses that would support this silver tsunami. So, for example, if you look at Netherlands, they have a facility called Dementia Village, which is so advanced and state of art, where they take care of all the patients that have Alzheimer's and dementia and have all the state of art technology embedded into it. So having those kind of facilities, infrastructure, and technology in place to support the silver tsunami, that is something that definitely countries, government, and businesses need to do. And obviously invest in startups like ourselves, who are working towards age tech solutions that are addressing silver tsunami, so that we can support the increased aging population. From the employer perspective, potentially offering this as a benefit for someone who's, say, employed. If I'm working somewhere and I have an elderly parent at home that I need to take care of, it could be like an employer benefit where, maybe I'm given some days off to take care of this parent, or buy a technology that is sponsored by the employer, so that I can, understand what's going on at home while I'm at work, and my my family is safe and sound at home while I'm working. So things like those and raising awareness, I think, are great things that society can do. And also podcasts like you that bring this platform and bring people together to listen to such conversations and engage and participate. I think these are great in bringing awareness as well.
I know one of the things that keeps coming up too in the AI literature is concern about privacy.
Mm-hmm.
So what do you think about that, and what's being done to address that?
For us, our platform is designed as privacy by design, where we were very, aware from day one that we need to have a solution that's going to protect the privacy of the patients. So there are ways to anonymize data, and there are also ways where you can develop the technology where you're not actually collecting any patient identifying information. So as long as you're not collecting anything that's patient identifying, then that would help to prevent a lot of privacy issues. So those are the kinds of the things that obviously the startups and the technology solutions in the market should be aware of to have privacy by design.
Going back to the silver tsunami, we just recently read an article, and we actually put it in our newsletter, and it's Jessica Hall, and she wrote in Morningstar, and she quoted Harvard Business Review's recent study that updated where we are with elder care versus child care, and we are officially more in elder care than child care. 23 million are doing elder care, and 21 million are child care. Mm-hmm. So the tsunami is real. It's absolutely real. And I can't remember the statistic, but I believe a small percentage of the elderly or adult children are institutionalized. So I hate to say it that way, but, or residents in facilities or in hospitals and institutions. The majority are still at home. Now, your platform, is it mostly for institutions, for facilities?
Yeah, so we're early stage. So right now we offer our platform to long-term care facilities and rehabilitation centers. And as we develop more, we want to be able to provide this solution for at home as well, whether it's through payers or through employer benefit. But that is like our greater vision, to be able to reach every patient bed in the country so that, every patient is safe, whether it's at home or it's in a facility.
How would you see that work at home? Like who would, I know you mentioned previously that an employer might be able to subsidize some of this, which would be fantastic. Mm-hmm. But is this affordable? Do you think it would be affordable, accessible for someone who can help somebody at home?
Yeah, absolutely. I think it's the way we develop the technology, it's even very affordable for the facilities. And access to care is very important because we want to be able to have all levels of income, regardless of the background, to be able to access this technology in an equitable way to, the facilities. And as we develop more solution towards being at home based care, we are going to keep that as the cornerstone of our product roadmap, that we want to be able to continue and expand this in a way where we are able to offer it to, home based customers where it's affordable.
I imagine that there'd be some training behind that, right? So it's not like, is it easy tool, you think? Do you anticipate?
Yes, it would be like a plug and play, just like how you get a television. It would be a plug and play technology. The reason being is a lot of solutions don't get adoption in the market is because you require a lot of customer training and a lot of friction in onboarding the customer. So we want to make the onboarding of our customers really frictionless, where it has an intuitive interface so that everything becomes easy for the customer to use it. And the care providers, even if it's someone who's working at an employer and providing care at home, they're already overburdened. They're doing their job and now they're taking care of their sick family member. That's a lot to do. And then going through training module after module, that's a lot to undertake. So we want to be able to provide a technology that's intuitive and works autonomously. Nothing needs to be done by anyone. You just plug and play, just like a light bulb, and it just keeps on doing its own thing. And if there is something that needs to be alerted or provided insight on, then they would just text the family member or message them on an app and tell them that XYZ is experiencing agitation. Do you want to talk to them or make a video call or something like that? I'm just giving a hypothetical example.
That's fascinating.
It
I mean,
is.
this is blowing my mind. I'll be honest with you. A hurdle that I see, and I know you'll probably have a solution for it, because there are some tools out there now that I don't know how integrative they are, but that can help a caregiver manage medications and get reminders, and maybe get family members to share in some of the tasks. But all those tools, to my knowledge, require input. You've got to sit down. Now, you already have working caregivers that are so busy that if they had an hour to sit down and input medication or input, so do you have a solution for that? Is there an easy way to get data put into these tools so that a caregiver doesn't have to spend a lot of time doing it?
Yeah, I mean, if there was, say, for example, a family member who's discharged from a facility, then their information about what happened to them in
Yes.
while they were in the
Discharge.
facility, yeah,
Discharge report.
exactly, that can be fed into the system
Oh,
directly, and it would just list out the next steps, and it would actually act like your assistant. So it's essentially, what can AI do? These AI agents, they are like your virtual workforce that are going to be like your secretary doing the job for you. That's what I'm trying to say.
Wow.
you're really blowing my mind, because I ran a home care agency for 13 years. And one of the biggest challenges we used to have is getting those discharge orders from the hospital as soon as they got home so that we could build a care plan on it.
Yeah.
And it just, for some reason, they were maybe written on paper and handed to one of the family members, and they got lost. I don't know. And so that's huge. If you could take and download discharge orders so that you have the medications, you have follow-up appointments, the pharmacy. Heck, if you can even get the pharmacy to automatically deliver to the house, then we're really cooking with fire.
Yeah, absolutely. Those are the workflows that can be automated end to end. So say a patient gets discharged and there are XYZ steps needed to be taken for the patient in terms of medication. They need to have like a specialist appointment after 2 weeks. It would go ahead and call the specialist, make an appointment for
Oh
you.
my gosh.
Yeah, and if
This is
the appointment
tremendous.
needs to be rescheduled, you can get that done as well. You can set up follow-ups. It would be like a step by step guidance for the person taking care of the patient, so they don't have to keep on, reading stuff on, say, pen and paper, or set up manual reminders on your phone that at 4 p.m. I got to give this medication. No, it would do everything on its own. You're on autopilot. So those are the kinds of the things that are definitely possible with the help of AI. And also helps in reduction of readmissions for the hospital too, from their perspective, from financial impact. Readmissions, they cause a lot of financial impact. So it helps to reduce the readmission, because now the patients are being taken care of according to the discharge guidelines. And so there will be less readmissions.
Wow. I'm assuming that the system can handle more than one patient at a time. Say you have a family where there's a husband and wife, they're both dealing with medical issues. You can use just the one device?
Yeah, absolutely. So the models are hyper personalized, the AI models, self-learning enhancement, where they learn and set a base for every patient. And whenever that base of the patient, so my base may be different as a patient than someone, say, who has some kind of condition. And if I don't have any condition, then our bases will be different. Whenever there is like deviation from our bases, it would detect those anomalies and identify that there's issue going on, and they would alert the care provider accordingly.
Do you, you may not have an answer to this, but do you visualize other ways that employers might be able to tap into this and help their employees who are caregivers?
Yeah, that is what I was referring to earlier, is if this were like a home-based solution, going from B2C business directly, B2B, it would be B2B2C, which is business to business to consumer. We could be selling it to employers like large corporation who would provide this as an employer benefit to their employees, where this gets, paid by the employer, and it helps their staff to work, to not take too many days off, and also be productive, because if you're distracted with something happening at home, you cannot give your 100% to work as well. So that's a benefit for the employers too, I feel.
Thank you for that. We're almost out of time. Somebody have a final question? I have one last one, but
just in terms of the marketing of your system, like where are you with that? Because this is the first I'm hearing of it. I've never heard of it, and it may be something that I need to help me with my care recipient. So where would I get more information about it, and how do I access it?
Yeah, absolutely. So obviously our website is owl.ai, OWLE.ai. We're on all social media channels, Instagram, LinkedIn, and Twitter. So that's the way to get in touch with us. And your question pertaining to marketing was, how do we go about marketing? It's very organic. We did not actually have to make a sale when we talked to facilities about these problems. These are like not vitamins. This is like a painkiller. So you really definitely need it. It's not nice to have, it's needed. And which is why we did not have to like push for, you have to buy this product, but they were like, when can we get this? And which is why when we did our pilot, the facility was, oh my God, we want this for all 5 buildings.
That's wonderful.
So it's not necessarily marketed to the consumer, it's B2B.
Yes, it is B2B. Right now we are selling it to the facilities, and then later on we want to offer it to employers as a benefit. Yeah.
I'm going to encourage everyone who's listening. I'm going to do a challenge. I like to do challenges, Selma. So I'm going to I'm going to challenge anyone right now who's listening, and they have a family member in a facility. You need to talk to your facility about this, and you need to reach out to Breana Patel and in her contact information and get her connected, because this is a lifesaver. This is time saver. This is. I just love it. I can't wait to see it in its full bloom. Is this your vision, or have you reached it? Do you have a grander vision, or is this it? I mean, where are you going to take this?
Well, we started with like falls and pressure injury predictions for the patients in the facilities, but then we realized that, there are a lot of other workflows that need automation as well. So we're not just looking from clinical perspective, but also from patient engagement and administrative automation as well. So we want to be the go-to platform when it comes to elderly, being able to take care of your elderly and provide them quality of care so that, when they are old, they can have a good quality of life. So that is the vision. And then whether it's a facility or it's an employer or it's a person providing caregiver, we want to be that platform to enable safety for the patients and also at the same time target the burnout for the care providers. Because care providers want to provide the care, but they are not able to because we are in 2025 and we are using technology from 1980s. So we need to change.
Wow.
Yeah.
Yes. Yes, we do. Oh my goodness, you got our vote for you to be the go-to
Yeah,
platform.
Yeah.
it's amazing.
It really is.
Yeah.
And again, we want to thank our listeners for being here. And we just want to let you know that we'll put all the links in our show notes, all the social media places to go and learn more and stay in touch with Breana. You want to do that. I think I'm going to talk to my facility. That's amazing. It's great stuff. Thank you so much for being here, Breana.
No, thank you so much for having me. It's so nice to meet you both. And thank you for your interest in this and spreading awareness for these topics.
Thank you for tuning in. Be sure to catch new episodes of Working Caregivers, the Invisible Employees podcast, every other Tuesday. Please also visit our website, invisibleemployeeadvocates.com, to subscribe to our newsletter, purchase our book, and learn more about how we can help you strengthen your workplace to become more supportive of working caregivers.